Hey guys, let's see about carcinoma cervix. It can be of two types, squamous cell carcinoma or adenocarcinoma. The most common type is squamous cell carcinoma and it is seen in the transformation zone. It has bimodal age distribution. First peak in 35 to 39 years and second peak in 60 to 64 years. And the causative organism is HIV, high grade lesions like 16 and 18. Risk factors are early coitage, early childbirth, multiple partners, immunocompromised, and adenocarcinoma risk is increased by OCP intake. Symptoms, the most common symptoms irregular bleeding or postmenopausal bleeding or postcoital bleeding. Then the patient can also have dirty vaginal discharge. The patient can develop pyometra, which is the collection of pus in the uterine cavity, and the patient can even develop renal failure. So on examination, the patient has an ulcerative or fungating mass, and the cervix would be hard to nodular in palpation, and in per rectal examination, we can find thickening or nodularity in the parametrium or uterosacral ligament. And we have the figure staging for carcinoma cervix. Stage 1A is microinvasive carcinoma where the depth is less than 5 mm. Stage A1 is specifically when there is less than 3 mm depth. A2 is 4 to 5 mm depth. In stage 1B is a macroinvasive disease with more than 5 mm depth. In that we have 1B1 where the size of the carcinoma is less than 2 cm. 1B2 is of size less than 4 cm. 1B3 where the size is more than 4 cm. Then we have stage 2 where there is upper 2/3 of the vagina involvement. In 2A there is no parametrium involvement. In 2A we have 2A1 which is size less than 4 cm. 2A2 where the size is more than 4 cm. 2B where there is parametrium involvement. Third stage is when the lower 1/3 of vagina is also involved. Here we have 3A where the pelvic side wall structure is not involved. Treatment for stage 1A1 is simple hysterectomy. If the family is not complete, we can do conization. If the stage is 1A2, we can do type 2 hysterectomy, or if the family is not complete, we can do trachelectomy. For stage 1B1, 1B2 and 2A1, we can do type 3 hysterectomy. For stage 1A2, 1B1, 1B3 and 2A1, we should do pelvic lymph node dissection also. For all other stages, we should do chemoradiation. We can give cisplatin as it is a radiosensitizer, followed by which we should give teletherapy to decrease the size of the tumor, followed by brachytherapy.